Welcome to another episode of the ALTUS Chiropractic and Physiotherapy podcast. I have Dr. Jose Otano here with me again. Jose, how you doing?
I'm doing great this afternoon. How are you doing?
I'm very well, and I'm very much looking forward to challenge myself to say this phrase, which is our topic today of TMJ, is temporomandibular joint disorder. Yay! I'm so proud of myself.
Exactly. It's a big word. It's a big word.
Big word.
That's why we shorten it to those three letters, TMJ.
That's right. So what is it, by the way? What is TMJ?
So I have actually a good skull right here, if you could see that. So this is actually your TMJ right there. You can see how it opens and closes. It's actually the joint right there that opens and closes your mouth. Oh.
And then it falls apart on you.
Then it falls apart. But yeah, so it's just pretty much this area of the jaw that allows it to hinge and open and close. And it has like an articulation between the skull itself and then the jaw. And then inside that jaw, you have particular cartilage that kind of helps it move up and down. So it's like a cushion. So it's not like a bone on bone situation. And it just allows it to bite, open and close, deviate front and back and side to side.
If there is a joint disorder, TMJ, what is the main cause of it?
So the main causes of it is what I see the most is through muscles of the jaw, around the jaw that get super tight from constant usage, from chewing harder foods, chewing on one side of the mouth versus the other side because you're favoring it due to like pain on one side. So from my standpoint, I see it mostly for muscle issues. And then also there's through trauma as well. So from whiplashes, head traumas can result into a jolt of the joint itself, causing a dysfunction of it from functionally moving accordingly. But then sometimes it's caused by too much talking, as we see in actors and actresses using their jaw muscles or singing too much, or just a strain in the musculature around the jaw in itself, or clenching. Another one is actually clenching while you're stressed. And when you're sleeping, you're clenching your jaw even more. So it actually causes the muscles around the jaw to even hurt even more. So stress is a big factor as well.
Okay. Stress, chewing, overuse of the muscles is what I'm hearing you say.
And then on rare occasions, trauma.
And trauma too.
Yeah.
So would you say there's a percentage of the population that will experience this disorder? Not everybody experiences this disorder.
Yeah, so there is a good amount of population. The statistics say around 40% of the population will experience a TMJ disorder in their life. But if it is something like where it's stress related, as soon as you remove the stress, it starts to calm down. Or as soon as you stop eating those chewy foods that are constantly causing those muscles to tighten up, it will calm down. So people will experience it, but at most times it works itself out after a couple of days or a couple of hours. It depends on how long the pain arises or on how you got it. If it was from a trauma or a car accident, it can be serious. It can result into some headaches and some severe pain. But in most cases, if it is just overusage or stress related, it's mild to moderate in the seriousness of the disorder.
Okay. So for our viewers to listen, they may be hearing TMJ. They may not know anybody in their family or friend network that has it. What does that pain feel like, if you could describe it?
Yeah, the intensity of the pain in the jaw can be from mild to severe, and it can be discomforting as well. It can be on one side of the jaw versus both sides of the jaw, and it can be tender to touch it. You're constantly rubbing it, affects your ability to open and close your mouth and chew foods. You can hear crepitus, which is just like clicking in the jaw itself, like it sticks. It affects your ability to talk sometimes. And then also it can cause some earache, neck pain, and some dizziness if it is moderate or severe. But most cases, it's just tenderness around the jaw itself and localized discomfort with earaches or headaches resulted with it as well.
Okay. Jose, would you say then that it's more the numbing pains type of feeling versus acute pain?
It's more of an acute pain because like it does happen fairly sudden. And then as you're like continuing on with it, and if you're ignoring it, it can turn into something longer lasting. But as soon as you kind of deal with it, relax the muscles around it, it will calm down.
Would you say that TMJ is associated to a dental issue or is it a medical issue?
So that's a great question. I would always say that you want to start off with dental just to rule out any pathologies, internal issues, because TMJ is very close to the molars in the back of your teeth.
Mm,
So my suggestion is always consult with your dentist to make sure that there isn't like a tooth issue, a gum issue, or any pathologies within the mouth that they can examine right away. And then from there, they will set you up with any things that they can help you out with for any devices or any referrals or recommendations, what they can see fit. But then if it doesn't get better and they say, no, your teeth are fine, your gums are fine, everything
mm,
looks good, then I would go see your medical doctor, your family physician, and then they will do an exam on the outside and also looking at the musculature of the joint itself. And medical doctors have their own specialists as well as an ENT, eyes, nose, and throat specialist that can do any further investigation as well on it. And they can
mm.
come up with the appropriate diagnosis of TMD, which is temporomandibular dysfunction slash disorder.
I heard you say earlier, when stress is relieved, it may go away. So I guess my next question is, can it be cured or go away naturally on its own? It sounds like in certain situations it can. From your
Yeah.
perspective, what have you seen?
Think it depends on what is causing the disorder or dysfunction. Unfortunately, if it's arthritic, if it's due to that, like I said before, that there was a particular cartilage that
Mm,
prevents that jaw bone from hitting the skull bone. And if that articular cartilage is worn away, which we see with arthritis, there's no way of coming out of it. You can do symptom management with it, but arthritis, you can't really cure that. But if
mm,
there is other issues of it, such as it's just strictly coming from clenching, from the muscles becoming super tight, then
mhm,
it can definitely be helped out. But then you're also looking at other conditions that are causing it, such as the articular disc can be torn as well.
mm.
So that results into more of a medical investigation, seeing the ENT or a TMJ dental specialist to cure it as well. So it depends really on what is causing the
Correct.
TMJ disorder or dysfunction. Because if it
Correct.
is the disc or the bones itself, then you're helping with the symptoms. But if it's just the muscles from overuse or tightening, then that can be cured.
Okay. All right, Jose. I'm thinking two things, two different types of people: folks who have Ehlers-Danlos
Mhm.
and folks who are boxers or MMA fighters.
Yeah.
Do both of them get associated and affected for what they have or what they do?
Yeah, so with Ehlers-Danlos, they have like elasticity of their connective tissue, so they're very hypermobile. They can get dislocations pretty easily. And you can also see that with MMA fighters and boxers that get constantly punched in the face.
Right.
So they're going to end up getting punched in the jaw because that's the center point of knocking someone out is in
Mm,
that area. Those two conditions are very interesting because if you can get a fracture here, but then only the amount of times getting hit here, the muscles are going to start to get very locked and clenched and stuff in boxers and MMA fighters. They are both predisposed to having a lot of TMJ issues, but
mhm.
I would say they would have their own medical consult with the Ehlers-Danlos. They already have the medical field looking after their care. And then the
Mhm.
boxers and the MMA fighters have their athletic therapists that are really on point with them to making sure that they're top notch before a fight as well.
Okay. All right. That's great. You mentioned earlier, Jose, about TMD, so temporomandibular disorder, right? How's that same or different to TMJ?
Yeah, so I get that question a lot from patients. What's the difference between a TMJ and a TMD? The TMD is the diagnosis of the TMJ. So if the TMJ, which is the joint itself, that's what the J stands for, isn't
Mm,
moving accordingly, it's not functioning properly, we call it a TMD, which is
uh-huh.
temporomandibular disorder, or interchangeably temporomandibular dysfunction. So the
Okay.
function itself isn't moving accordingly compared to normal values. So, for example, the range of motion, there's pain with clicking or pain with articulation, stuff like that. So, that's the main difference. One is strictly talking about the joint, the TMJ, and one's talking about the
Mhm.
diagnosis, TMD.
Okay. It was not till today that I've heard of TMD. I've always known it to be TMJ.
Yeah.
So, as a practitioner, then, What kind of modality or treatment types are you practicing or working with clients that have TMJ or TMD?
Yeah, so once we find the appropriate diagnosis after they saw their dentist, sometimes it's just after seeing their dentist, they get the diagnosis of a TMJ or TMD. They will hopefully, I would always recommend getting them a night guard. A night guard is just like a retainer or like a mouth guard that they would wear at nighttime. It
Hmm.
really helps in because it kind of sets the jaw in that neutral position. So they're not making things worse at nighttime when they're sleeping. So that's the number
Hmm.
one thing I try to convince and help my patients get when they have a TMD disorder or TMD. And then from there, we do a lot of hands on stuff. So it is relaxation of the outer muscles like your temporalis, your masseter on the outside. And then we do some internal relaxation or mobility on the inside, which is your pterygoids, which is on the back end of your jaw back here. So it is, I have to put on a glove and do a little bit of muscle release on the inside of your jaw too.
Wow. Okay.
And then after those muscles are nice and relaxed and treated by massaging and stretching, we then can look at the range of motion on how they're opening and closing. If we do need to do a little bit of mobility on the jaw itself, we do that as well. And then we offer them, give them exercises and stretches that they can do at home for at home treatment. So that's a
Okay.
lot what the therapist would do. And it's not only chiropractic, massage therapy can do this, physiotherapy can do this, and chiropractors.
Okay. That's incredible. I didn't know that much information about it. So I'm glad to be able to know more about it. Jose, in wrapping up today's episode, any final words to our viewers watching this? They may have somebody they know that has TMJ. Somebody who has TMJ might be looking at this episode going, oh, I get it now. Any final words that you have for them?
Yeah, like I said from the beginning, TMJ disorders can subside on their own. In most cases, they do. So just don't be alarmed on it. Give it a couple days. If it's still bothersome and it's still painful, or if you're getting a clicking sensation with pain,
Hmm.
first always start off with your dentist. Start there just to make sure there's no other underlying issues. Go see your dentist. They'll do an x ray, they'll do a follow up. They will recommend and give you the proper diagnosis that it is a TMJ disorder that is causing your pain. Then from there, you can consult with any therapist that the patient feels comfortable with because a TMD disorder can be handled by a massage therapist, a physiotherapist, or even a chiropractor. So they don't need
Okay.
to just see that one therapist to help that TMD disorder. It can be any of those therapists that I just mentioned. They're more incapable of helping you out with this disorder. And it's whatever the patient feels comfortable with.
That's great. Thank you, Dr. Otano. Here, and there you have it. Temporomandibular joint dysfunctional disorder, and all you ever wanted to know about
Right. Yeah, you
it.
got it perfect on that.
That's awesome. Thank you for sharing so much information. And that brings us to the end of today's ALTUS Chiropractic and Physiotherapy podcast. Stay tuned with us next week as we cover more physiotherapy and chiropractic topics. Dr. Jose Otano, thank you so much. And I look forward to having you on another episode soon.
Thank you, Sherman.